My name is Ronnie, and my disease presentation choice today is going to be Ebola virus. Ebola virus is a deadly disease that affects mainly human beings and animals like gorillas, monkeys, and pigs, and others. This disease is spread by various types of Ebola viruses, and some of the types are Western virus, Ebola virus, Sudan virus, Ebola virus, Thai forest virus, also known as the Thai forest Ebola virus, Bundibujo virus, and Sudan Thai forest virus and Bundibujo viruses are the viruses that are known in people, while the Western virus is known to be spread by pigs, while Bombardier virus is known to be spread by bats. Ebola Ebola was first discovered in Democratic Republic of Congo in 1970s after it had affecting and causing outbreaks. But Ebola up to date has not the cause of Ebola has not been found, or the medicine for Ebola that could cure Ebola virus hasn't been found, though it has claimed so many people and they have no knowledge where it came from. Ebola is transmitted through many ways, and the main transmission is through bodily fluids. Bodily fluids like sweat, mucus, maybe even open skin, or even through sexual intercourse. Um, Ebola can be spread through fluids through the nose, breast milk, excuse me, milk, vomit, or even semen. Ebola can be transmitted through objects like syringes or sharp needles that have been used on Ebola patients. Those ones will also transmit Ebola. They can also foods that have been consumed by probably humans or people that have been suffering from Ebola patients. Those kind of fruits, probably fruits, foods, all those which will transmit Ebola. Bodily fluids like sperms, probably through sexual intercourse, they will also transmit Ebola virus. Research shows that even though survivors do not show symptoms, Ebola virus can still be in them. There have been cases where people have been surviving with Ebola. They have been diagnosed with Ebola, but they probably get better medication and they get cured. Ebola can be prevented through um, Ebola can also be transmitted through attending funerals. Different traditions have different ways of handling funerals. Some funerals, the people that come to attend the funerals tend to do some kind of rituals on the body. So, on Ebola patients, there is no need to do any kind of ritual because the dead body is still active to spread the virus. Um, it is also transmitted through blood. If you get in touch with somebody's blood that's been suffering from Ebola, if you get if you get in touch with a patient, Ebola patient's personal properties or belongings like clothes, utensils, forks, you can also easily be infected. Um, Ebola virus can also be transmitted through animals. If you have a pet that's been affected with Ebola virus, you are in a situation where you can easily contract the disease. Be it a dog or gorilla or monkey, you will easily get infected. Now, Ebola virus symptoms show between 2 to 21 days after someone gets infected with Ebola virus. And some of the symptoms that someone that usually can show up is bleeding or bruising, unexpected hemorrhage. Now, bleeding can be through the nose, the ears, the eyes, the mouth. That is unexplainable. That is one of the signs of Ebola Ebola virus. The patient also gets fatigued, diarrhea, vomiting, fever, severe headache, weakness, abdominal pain. That some of them they cannot be explained. Those are the symptoms for Ebola virus. Ebola can be treated only through treating its own symptoms. If you have a muscle ache, treat it. If you have a severe headache, treat it. A fever, treat it. Vomiting, treat. Diarrhea, treat whatever you feel like you're suffering from, and that's how you can eliminate it. Try to survive or eliminate Ebola out of your system. Um, Ebola can be treated, like try of treating through offering more fluids, administering more oxygen, probably giving oxygen tanks, trying to add more oxygen in the body because the body's trying to get weak. So you try to give it some oxygen, to give it some energy. Also administering blood pressure, giving blood pressure medications, and probably reduce vomit, diarrhea, reduce the fever and pain. Also, treat any infections that probably is coming up. Um, Ebola survivors usually feel muscle aches, stomach pains, tiredness, even they also have a problem with reuniting with their families or communities where they belong because people are just scared that they may contract the same disease. So people try to segregate or discriminate them for a little while as till they feel like they feel safe. Now statistics came up like there are about like 28,639 confirmed cases of Ebola by 2014, and within that period 11,316 people had died out from Ebola. That was in West Africa. And they keep coming up, once in a while because Ebola, probably somebody dug up a grave with Ebola virus, and the person that passed on with Ebola virus, and the virus comes back again. Probably the animals that are suffering from Ebola bring it back in public again. So Ebola keeps on coming back and forth. All in all, before you travel to any country, outside country, probably out of the US, United States, there are about 14 cases that have been diagnosed with Ebola, and they are not usually in the United States, they're usually in the West and East African countries. So before you travel to any of those countries, go do a thorough check about the diseases that affect those people, and probably do a thorough research, because when you get infected, probably even your own doctor may not know that that's Ebola, and you won't be able to treat it. And if you don't get quick attention, you may die. And the lifespan for Ebola, by the way, is just 2 weeks. So if you are not treated before 2 weeks after the symptoms, after being diagnosed with Ebola, chances of surviving are very slim. So I chose Ebola virus because I once lived in a country that Ebola was diagnosed, and people suffered from Ebola around that area. And it's a scary disease that you don't want to be next to anybody that's suffering from it, because it is an epidemic that just keeps wiping out people, especially if they don't know what it is. And it's a scary moment when you can't leave to handshake your neighbor or visit or anything. It's a little bit scary. Otherwise, that's my video presentation today. Thank you.